So here are the top 3 things I rarely see patients do that can mess up the results after surgery. And this kind of applies to all surgeries in general. Thankfully, these are very rare. I have wonderful patients. My patients tend to be super well educated and don't do these things, but here they are. So number 1 would be not following instructions. It's extremely rare that this happens because patients are invested in so many different ways in their surgeries and their outcomes. But there's certain things you just have to do. Like for example, in top surgery, you gotta put the ointment on the nipple if it's a free nipple graft. If it's a vaginoplasty, you gotta dilate. And so sometimes folks can have emotional difficulties after surgery and it can become a problem. So we wanna make sure we're as prepared as possible before surgery, that we have our support system there and we're going to be able to understand and follow the rules. So that's number 1. Number 2 is unfortunately a little bit more common, and this is when patients go AWOL. Patients just stop communicating with us, and especially if the patient has a problem. So within reason, obviously, if it's an emergency, the patient should seek medical help immediately, obviously. But within reason, every surgeon will tell you they want you to come back to them with their problems. They know what they did during the surgery. It's what their area of expertise is in, and it's going to be usually so much more helpful talking to your own surgeon rather than going to the ER. The ER doc, for example, doesn't do vaginoplasties, doesn't do top surgeries, and we're putting them in a difficult position. And for that reason, oftentimes they're going to do all the tests. They're going to do the CAT scan, they're going to prescribe all the things, and it may not even be worthwhile. So if you are seeking medical help, and we really encourage our patients to do this, you always want to loop your surgeon into the process or give them a heads up, let them know what's going on. In all the fails I've had in my career, usually that's been the theme, that patients haven't stayed in communication and we're not able to help them, subsequently if we don't know what's going on. So that's number 2. Number 3 would be breaking the rules. So there's certain things you just don't want to do after surgery, and your doctor will let you know exactly what they are. It's very rare that folks do these. Probably the most common thing would be smoking. We don't want our patients smoking anything or even vaping 6 weeks before surgery, 6 weeks after surgery. Sometimes patients forget to eat. I've only seen this happen twice. You need to keep a good diet so your body has the building blocks in order to heal their wounds. And then sometimes, extremely rarely, just bad decision making, like going out partying all night, drugs, that sort of thing. So thankfully this is all incredibly rare, but you want to just make sure you have your support system there. You have all the different ways to communicate with your surgeon to make sure we're prepared and none of this is going to happen to you.